How is dementia diagnosed? Diagnosing dementia, its type and causes can be very challenging because there are over 100 types of dementia. Some are progressive types, and others may be reversible. Doctors must identify if there is a pattern in the loss of skills and abilities of a person, then assess what the patient is still able to do. There have been many advancements to diagnosing Alzheimer's disease that have allowed for a more accurate diagnosis. The doctors can now check for biomarkers. In the past, the only definitive way to know if a person actually had Alzheimer was to do an autopsy on the brain performed after death. So, the first step to diagnose a type of dementia is to review your medical history and discuss your present symptoms. A full physical examination will be completed. It's important that a family history be included. A few questions you can anticipate being asked are: does dementia run in your family? When did the symptoms start? Have you noticed changes in behavior or personality? Do you have any other medical problems, or are you taking any medications? No single test can diagnose dementia, as there are so many different types. Doctors will need to run a gamut of tests. These tests will rule out the reversible types of dementia as a first step. Reversible dementias, if treated early, can decrease or eliminate the signs and symptoms of dementia you may be exhibiting. Blood tests can detect physical symptoms that can affect brain function. These include things such as vitamin B12 deficiency or an underactive thyroid gland. There are times spinal fluid may be examined for infection, inflammation, or markers of some other degenerative disorder. Your primary care doctor might refer you to one or more of these types of doctors for certain tests. A neurologist who specializes in the brain and nervous system, or possibly a psychiatrist or another mental health specialist, a psychologist or a neuropsychologist who specializes in memory and mental function, or a geriatrician who specializes in the care of older adults. A comprehensive neurological evaluation will be completed. This might include brain scans, a CT or an MRI. These scans can check for evidence of a stroke or bleeding or a tumor or even hydrocephalus, which is water on the brain. A PET scan. These can show patterns of brain activity and whether the amyloid or tau proteins, which are hallmarks of Alzheimer's disease, have been deposited in the brain, or they can show the plaques of Lewy body as well. The neurological evaluation may include many different types of tests to evaluate you. Cognitive tests are done. These measure your ability to think. They focus on things like memory, counting, reasoning, and language skills. And there are many different types of cognitive tests that may be included in your examination. They may include the tests like the animal naming test, the clock drawing test, the Cognostat test, the St. Louis University Mental Status Test, also known as SLUMS. And the most common test is the Mini Mental Status Exam. They will assess your visual perceptual abilities. As they are taking these tests, they're going to focus on your ability to problem solve. Movement, your senses of hearing and eye movements will be assessed as well to address your balance and your reflexes. Remember, it is as important to rule out diseases to provide an accurate diagnosis. A psychiatric evaluation by a mental health professional may be recommended. This is to determine whether depression or another mental health condition is contributing to your symptoms. If you have concerns about dementia, I'm going to give you a few suggestions to put together for your first appointment when you want to discuss this with your physician. A list of symptoms. Include everything you're feeling, even if you don't think it could be related to dementia. any source of major stress or recent life changes, make sure they're aware of that. A list of all medications you take, including vitamins, supplements, nutritional products that you take, and the dosage of those. A list of any questions you may have. Has your family member noticed any behavioral changes or personality changes in you? If you have had a family member that was diagnosed with dementia, it would be helpful to know the type of dementia they had and to share that information with your primary care physician. If you or a family member suspects that you have signs and symptoms of dementia, see a doctor right away. Early diagnosis and treatment will allow better access to medical and mental health services. Early diagnosis of a dementia disorder has been shown not only to improve the quality of a person's life, but increase the chances that person with dementia will live longer. So not only will they have a better quality of life, they're going to have a better quality of life longer. Early diagnosis and treatment can slow the progression of the disease. I'm Diane Carbo, RN with Caregiver Relief.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below